Hello, my name is Dr. Brian Raid, and I'm a naturopathic doctor, and this is a video about troubleshooting when mitochondrial support supplements and other therapies are not effective or not fully effective for patients. I talked about mitochondrial function and the impact in chronic disease in a number of videos in the past, so if you want to hear me talk more about this, please check out some of those past videos. But the long story short is that the mitochondria, these little energy producing units in the cells, they essentially make all of the energy for our cells. I mean, in reality, it's more like 90%, but let's just round that up to 100%. And for simplicity's sake, say they make all the energy for our cells. So very, very important. So when patients say they're feeling tired, when they have brain fog, when they're not healing optimally, when there's issues with their detoxification pathways not working as quickly and efficiently as we'd like them to, those are all characteristics of there being some mitochondrial dysfunction. The cells are just not cranking out enough energy to meet those physiological demands, and so the patients have symptoms. So as I'm very fond of saying to my patients, to my residents, when I'm lecturing about this at conferences, it's really all about the mitochondria. And so when we give patients mitochondrial support, and the approach I take is to use a very comprehensive approach, giving patients combination supplements that have all of the nutritional cofactors that the mitochondria need to function optimally, then if it's all about the mitochondria and we're giving the patient everything that their mitochondria might need in a supplemental form, then it should work miracles every time, right? It should be, just such a make everybody's life so simple. Just treat the mitochondria, everything gets better. And that unfortunately is not always what plays out. Now, granted, in many cases, when we have the right other pieces of the puzzle in place, then that mitochondrial support can make a huge impact for patients, which is why I talk about it so much and use it so much in practice. But when I give patients when I prescribe mitochondrial support to patients, or when my colleagues do, and they, and they say, hey, like my patient's on this mitochondrial support, and they're only partially better, or they didn't see any improvement at all, like what's going on? Or when I see that in my own patients, what's going on? And what that tells me is that there's something that's blocking the ability of that patient's mitochondria to make enough, to be able to make energy, to be able to use all those useful tools that are being given to them through the supplements. So in other words, there's something blocking the mitochondrial ability to make energy. So when I prescribe to a patient comprehensive mitochondrial support, they come back maybe a few weeks to a month later, and they say, like those ozone injections you're doing for my infected joints, like that's helping, and my brain fog is doing better with treating the mold, but like I'm just not noticing an energy improvement with this mitochondrial support at all. Then I look at that as being sort of like almost like a pseudo-diagnostic test in a way, saying like, well, we're supporting your mitochondria like crazy, yet you're not feeling more energy. So there must be something blocking those mitochondria from making energy. And the things that can block mitochondria include heavy metals, mold toxins, chronic infections, particularly viruses, but other infectious microbes likely can do the same thing as well. Environmental contaminants like pesticides and herbicides and whatnot. If there's insufficient function of the thyroid gland, the adrenal glands, these important glands that secrete hormones that tell the mitochondria to make more energy. If there's an issue there, that can lead to mitochondrial dysfunction. So there's a million and one things that can go wrong when it comes to mitochondrial function. And so if that mitochondrial support's not knocking it out of the park, then it's an indication that there's something going wrong physiologically that's blocking those mitochondria from making the energy that they're supposed to. The analogy that I use with patients all the time is that if we pretend that our mitochondria are like car factories, and the cars that are produced are the ATP, that cellular energy that we need to function, then when we give the body when we give the mitochondria all this mitochondrial support, the right vitamins, minerals, amino acids, antioxidants, etc., then it's like we're revamping that car factory to be as state of the art as possible. So there's new machinery, there's really great ambitious workers, there's lots of electricity and running water, and like everything that's needed to just have the best cars in the business being made. And so that's what we're doing. But if that factory is being sabotaged by, like, monkey wrenches going in the gears, and there's bombs going off here and there, destroying equipment, and there's, a poisonous gas leak in the factory. Well, you can have all the state-of-the-art equipment, the best workers in the world, but they're not going to crank out very many cars because it's a really toxic, hazardous place to work there. And so in this analogy, of course, the bombs and the poison gas and all that, that's going to be your heavy metals, your mycotoxins from mold, your chronic infections and whatnot. So again, when patients are not responding, or when they're not seeing a really great therapeutic benefit from that mitochondrial support, it tells me, okay, we haven't cleared up all those sabotaging factors on the car factory. We need to, look at the case again. It's like, hey, we haven't talked about mold, like, any history of mold exposure. Oh yeah, I was exposed to tons of mold when I was in college, and actually that's when a lot of my symptoms started developing. And in a case like that, it would really be shame on me for not having picked that up in the initial history. So hopefully that wouldn't be the case in actual practice, but there might be something like that, or it's like, hey, we've treated the mold, we're working on the Lyme treatment, but maybe there's a heavy metal component, so that might inspire us to test for heavy metals, and might see like, oh my gosh, you're full of mercury and lead. A non-response to mitochondrial support therapy, it's always disappointing. Of course, every time we as clinicians prescribe something to our patients, we want to see them do fantastically well. We want everybody to get better. That's why we're in this field. But when a patient says, I'm on this mitochondrial support and it's really not knocking it out of the park for me, or I'm improving very slowly on it, then that's telling me like, okay, this is useful clinical information. We know that maybe we'll back off on the mitochondrial support or go on more of a maintenance dose of it, and let's dig a bit deeper and figure out why it's not working incredibly well for you. So I hope that this information is helpful. If anybody has any questions or comments about this topic or anything else, just post them in the comment section below, and I will answer them, or perhaps post a video about that topic as soon as I'm able to.